I think that every moment, every small step is a colorful beginning. It's a step toward a brighter future. It's a step toward their ability to be more independent as adults. So I think most parents, when they receive the diagnosis, initially think, now what? The truth is, people live with autism every day and function better than you and I sometimes. And it's really about understanding their child and understanding their strengths and believing and hoping that with treatment, their children can live that life that they've envisioned.
Kaleidoscope ABA is building off of our foundation of 15 years of providing services for individuals across the lifespan with a variety of needs and abilities. So we really value, being at the forefront of best practice and implementing what we know is going to be successful for a child. Early intervention is extremely important. Research shows that the earlier you can intervene with a child, the more successful they will be in their later outcomes. So we really want to start early on where they are more receptive to treatment, and we can provide consistent, frequent therapy that we can also implement in the home and help parents from those early days understand their child and their needs and carry that through into other settings with them and ultimately into school and the rest of their life.
The principles of ABA, which stands for Applied Behavior Analysis, we can focus on the word applied. And what that's saying is that we're teaching these socially significant skills that are relevant to the individual. And that's really what we're looking at if we had to focus on one thing.
So every treatment plan is going to be individualized to the child and their specific needs, and we will be picking goals that make sense for that child and their family that they want to work on. As we're working with a child, we're taking data, which is just us gathering information, and putting that into practice with what does this behavior look like and how do we need to alter our approach to meet the needs of the child.
I know that with ABA, with consistency and a lot of dedication from people that are involved, it works. I think it adds to encouragement to see what can be the potential for that individual.
Center-based services for a client will be a mix of structured and less structured activities where we can provide one-on-one treatment and really target goals consistently and repetitively, where we have the ability to limit distractions and create an environment where we can build up success in a skill and then generalize that to a different type of setting, such as their home.
We can focus on things like everyday tasks like cleaning up after themselves, doing their homework, and in the community we want to focus on social skills so they enjoy themselves out there. We want them to have those friendships and those connections that make their life worthwhile.
Home-based services can also encompass going into the community based on what the child needs to work on and what's beneficial for the family. If they are struggling going to the grocery store, that's something we can support them with, and that's something that we can help talk about. What are the strategies that we need to focus on for this? Can we build those up in a successful way in the home before we take them outside into the community and support the parent all the way through that process.
How much time does ABA take? How much time is my child going to need to be in a program? That's going to vary on your child. We're always going to start with an individual assessment, and that assessment is going to end with a conclusion where we're going to make a recommendation for service hours. And that's going to dictate what we think would be relevant to your child for them to make the most progress at this point in time. When we see a child and we recommend that they come into our center, what that means is we think that they probably need a little bit more consistency at first. They might have more skills that they really need to work on to be able to move into a school eventually. And if what we're doing isn't continued in the home, there's not going to be as great of a result. There might not be any result because things that are happening at home might sort of undo what we're doing. So training parents and making sure that parents have a buy-in, that they feel comfortable, that they feel supported by us to take what we're doing in our sessions and transfer it is the most important part of what we do.
Our ultimate goal is that we decrease our services. We want our kids to be in a less restrictive environment and be around their typical peers and be able to be in a group for a longer period of time.
I would say you want to find a provider who you can relate to, where you believe that the treatment that they're offering is in the best interest of your child. where their treatment is based on evidence-based practice. And applied behavior analysis, is the gold standard for treatment. As much as we're working directly with the child, we also are working directly with the parents, with the siblings, with grandparents, the people who are most actively involved in that child's life. We have a lot of technological tools that families can use. We have a program that parents can access and see the scheduling, the notes, the data from each session that we run. They can provide HIPAA-compliant messages with us back and forth through that software.
It's really nice to see that parents that were discouraged at one point in their life with their family and not seeing any hope, they have hope now, and they're basically advocates for other families so that they can know that it does work.
It's normal to be scared if a parent sees a child having different behaviors, or if they might be a little bit more, you might say, cranky or a little bit more upset at first, and that's okay because everyone's scared when they're going through transitions, but the other side of the transition is what we're really aiming for.
I mean, just like all of us, right? Don't we all have our own individual traits that make us who we are? And so if we treat children individually and personalize service, and it really comes from a place of compassion and ability that we can create and construct a colorful difference, we can create and construct a new beginning for these children, I think that's important.
This is what your child is going to succeed in. This is what they are going to need to give them the tools to one day look up at you and smile at you, to tell you I love you right back, all the times that you told them.